just realized, guys, that I wasn't recording this. This is so bad. And I just started recording. I'm so upset right now, but that's okay. We're going to move on.
Just your moment.
Right. And so if we realize we've done something that's hurtful to kids, we want to acknowledge that, as I said, we make mistakes and we want to start the healing process, right? And we want to make sure that we try to, the big part about trauma is as you're healing, right? As you're doing the work, try not to re-traumatize, right? In that particular area. So that's key too, to set some things in place that buffer and that don't end up hurting the child again or more. I suggest that you talk to your pediatrician, right? Talk to your pediatrician or talk to some trusted individual or a therapist and say, I think what's going on is hurting my child because I may be recognizing that they're changing or something's going on with them. I think this divorce is hurting them. I think the way we argue is hurting them. I think my mental health issue is hurting my child. Ask for help again, and then do the work. Follow those resources and do the work. And just know, I think the big part here is that parents find it hard sometimes to ask for help. Even in this conference, we had a session, we talked about, we had a question about how do we ask for help and reach out to collaborate. We're even shy about that, right? Because you don't want to ask people. I think I was a little apprehensive and had to gather myself to call you, Dick, to say, can you do this with me? Right? And so getting over that barrier and asking for help is something that we all need to work on. Okay. And so there are so many services out there and different therapies that can address trauma. And so depending on what's going on with your child, if you recognize there's behavior changes, they're behaving withdrawn or isolating in their room, if they're very jumpy, like stressed, like that stress response system is overactive or angry or getting into fights, recognize that maybe what's going on, what's happened to them or the environment they're in is the source of these symptoms that you're seeing, and go see the doctor and bring that up to them. You could even take the ACE questionnaire. And we should have that for families, or talk to them about that and take that survey and take it to the doctor. And depending on, those symptoms and what those symptoms are would dictate kind of what services your child may need, or your family. It may be family counseling. It may be behavior therapy. It may be trauma-focused cognitive behavior therapy. It may be, healing practices. It may be something like, okay, Dr. Nadine Burke's healing practices. It may be, okay, let's get plenty of sleep. Let's get plenty of exercise. Let's eat a healthy diet. Let's get out in nature more. We're going to do the therapy piece. Let's work on our relationships. So we'll do some family counseling. So all of those things are healing practices if you feel that your child has endured some trauma, and especially if you feel like you are that source in some of your discipline and parenting styles. And so I mentioned a bunch of things, but all of them are helpful, and you can start anywhere. There's no particular order.
I'm gonna follow up on that because I think you gave us, which was generous of you, to kind of a profile of some of your patients and some of the struggles they have. Um,
Hey, honey.
and I don't want to over romanticize the childhood adverse
Something
experiences,
strange?
but
I
but
guess
what I
I could. I'm gonna go to.
Can we mute,
but
please? Sorry.
oh, I,
Thank you.
I think they were offering to. I think they were offering to pick me up, which is good. I'll Uber. I'll take it. Here's my question, because you made the point, a very very good point. You anticipated the question about about the parents and the burdens on the parents. They're financial stress. They've lost their job. They can't get a job. They might have a mental health challenge. They might have an alcohol, substance abuse challenge, whatever it might be. So my question is, and you made a point before we got on the air here. You made the point before we got on the air here that not enough the business community is involved. So my question, maybe it's an overarching question, is: so when you have that parent that has it. You can't just say find the job. You can't say cure your mental health issue. Are there resources in the community to which you can refer these people? So if they have a challenge like that, mental health, they get referred to Aspire. If it's unemployment, maybe it's career source or whatever. Is there a way, or is there a system in place in the community where people can be referred so that parent can begin to address what is aggravating the situation and might be impacting their relationship between themselves and the child?
Yes, yes. That's a great question. And that's what pediatricians should be doing. And that's what we're trying to make happen with our network, that every sector is equipped to recognize this through the lens of trauma in their employees, their coworkers, whomever. Look at what's going on with that person and say, what happened to you and how can I help? And have that at that place to help them out, whatever the struggles are, whatever's going on. But as a pediatrician, when I know that there's trauma in the child's life, they have ACEs and we see symptoms of trauma. And when we talk to the family and recognize that this area is deficient and this area is deficient, well, they don't work, they're financially strapped, there's alcoholism or something like that. It's my job. I have a resource book this big. It's my job to point them to substance abuse counseling, right? And make that call and help them out, or mental health services. It's my job to get them into a parenting class, to find that counselor that they need or their child's need, and to hook in with behavior therapy or call the school. And so these are the things that pediatricians should be doing, or nurse practitioners, any pediatric provider. I care for mom, dad, all the children, everybody. And although I'm not that parent's doctor, if it's something that's impacting that home environment, it is going to affect the child. So it's my job to address
Right.
that too.
Yeah.
Absolutely. And so we all as a sector have to be interconnected, share resources, work together. And that's why you're right, Dick. We need the business sector on this, because mostly everybody's going to find a job or have a job. And if businesses are equipped in this way, if they are already talking about this and say we have resources or a mental health arm, or if you need support arm, all of these wonderful things, just imagine how much better our community will be.
Good. If anyone's posted a question, I don't see it. Do you have any that you can read that have been posted?
I
'Cause we
see
want.
I see lots of wonderful comments. I
Great.
do see you might be planning to do this, but I am trying to find your book on Amazon. What is it called? Yes. And definitely we were going to give you guys, and it's probably about time for that. Um, let's see. Yeah, it's about time for that. We're done with questions unless Dick had any more. We're going to take your questions, and this is the
Please
book. I'm
do.
going to show that at the end. High Five Discipline: Positive Parenting for Happy, Healthy, Well-Behaved Kids. You can get it on Amazon, the AAP website, anywhere really, any book outlets, Barnes and Nobles, everywhere. Just Google it; it'll come up. You can go to my website, which would be great, which is drcandicemd.com. DRCANDICE. That's on my shirt here, drcandicemd.com. And you can you hit the book tab and you link right to the book on Amazon.
Right.
And if you get this book and you enjoy it and it's helpful, or if you have any questions for me, please rate it and give me a review on Amazon. That really helps with going towards numbers and how successful this book is, and also for the AAP, the American Academy of Pediatrics. So that is the book. I had some links. I can see if I can pull it up. I'm bad, y'all. I can't find it now. It was on another window, but I'm not as good as Rachel with this stuff. But I see one hand up.
Great. I'd love to have a question.
That Isabel?
Yes. So I have a preteen. She's going to be 13 this summer. And the thing is, like I said, when you mentioned that discipline is about teaching, and one of your top 5 was to, like correct the inappropriate behavior. And I was just curious, does your book kind of have like wording on how to do that? So because she's just like, oh, geez, because yes, I mean, do I go in sometimes and just like, whoa, can you clean up this room, please? And that's my way of saying I wanted to clean up a room. And then, but again, that preteen attitude is just like, well, did you really have to say it like that, mom? And I'm just
Oh,
like, um, I'm like, "Y- sorry. I was just like, but you don't notice that you have no place to sit in this room? You know? And so it's just like, yes, maybe I can be a little bit more conscious of my words, but I don't know them because yeah, when you kind of go into that, you just automatically hear your own parents and it's like, well, that's what they said when there's
yeah,
like, why is the laundry
yeah,
basket still full? It's like, "Ooh,
right.
okay, that's my cue to like start the laundry now." And so I was just wondering, does your book like include language to use on like how to correct without judging, if that makes
Yeah,
sense?
yeah.
Makes sense. Yeah.
You're absolutely right because that teenage period, we know they're in puberty, the hormones are raging. As women, I think I see most of the names look like woman, female names tonight. So if you know that you went through pregnancy, maybe if everybody has had children and the hormones of pregnancy, right? And how that feels. And then after you have the baby, the hormones of that. You feel like you're crazy, right? You're like, oh. And so teenagers are going through that. These are hormonal imbalances. And that's part of the reason why they're so edgy and irritable and smart mouth, right? Some of that stuff. And so, yes, I do have information for that. So this is called Part 4, Child Basics. My favorite little saying, act like a parent, but think like a child. Okay? You
Mm,
are the
mm.
parent. You have to be the parent, but in order to do it successfully, you've got to think like a child. So there's a whole chapter on teenagers, adolescents. We start with babies and toddlers. We go to school age kids, and then we do the adolescent period. And yes, we have lots and lots. This book is full of examples, things I've seen clinically. I change names, of course, but I share stories. I give you the language, like they said this and you say this. There's a skills section in the book where you literally have scenarios and you're going to say, answer the questions as to how, based on from what you learned in the book, how you should respond to that. But this is an art of parenting. There's so many options. I don't want anybody to leave thinking they have to do this a certain way. You put your flavor on it, your style on it, but just as long as it's in that range of being being healthy for your kids, basically. And so you get to decide that. So yes, there are tons of examples there.
Great.
Anybody else? Thank you. That was Angela says she's got the book in her cart. I appreciate
Great.
that.
Well, I'll have to tell you, Dr. John, I'm going to buy you a book. I've got three boys, as you know. They're 35, 32, and 28. One is getting married in May. They're getting
Yeah.
married on Friday, Friday the 13th, which shows some kind of confidence in how long this marriage is going to last. I don't mind the 13th. But anyway, and they want to plan a family, so I think your book is appropriate for them, and it would be very relevant for them to have. So I'm going to do that. But there's also some humor in raising children that you sometimes have to find the humor and then kind of use that as a salve, right?
Right.
I was remember one time my youngest son, he was being know-it-all. They tend to be at that age, 5 years old, know-it-all. So I said, well, I'll try to use some levity and get even with him. So I said, okay, son, if you're so smart, remember the question they would ask you in school. If a train leaves St. Louis traveling 30 miles an hour at 5 o'clock going to Houston, Texas, what time would the train arrive? My son had the best response. He said, I'm not on the train. I don't care. So, so, so I said, well, actually, that's a very good answer. So
Right.
I
Stopped you
found some,
cold.
I found some levity in that and made use of that levity, which kind of diffused the situation. So sometimes kids can say some very interesting things that can be diffusing
Right.
in this bad situation.
Yeah, and I think you redirected that so well, right? You just You did the matrix on it. Like, phew, not falling for that one. I redirect you to this one. It just changed the whole atmosphere. So
Yeah,
you're absolutely right.
I did the Spider-Man thing on him. So
Yes.
he was confused. Any more questions we have for Dr.
I
Jones?
think Maria raised her hand.
Okay, let's do this. Maria?
So my question was, a lot of times the grandparents always get the bad rap about being, the disciplinary people, they want to do the punishment and all that kind of stuff. But I'm really not like that at all. So, I'm more like the way all those things you talk about in your book. And it's only really because I think I've grown because of doing the work in this field. That's what has caused me to realize how I need to change and how I need to bring myself to the table in a very different way. But it's almost sometimes it's so hard having that conversation with people that are so entrenched in that whole concept that no, I need to whip my kids. I can yell and scream. I'm the mama. It's just so hard to get past that with them to make them understand. Do you realize what you are doing to your child? There's a different way. There's a new way. But they're so entrenched in, and it's like I don't even know sometimes how to get them out of that mindset.
It's really
Mm.
hard. It is so hard even for me.
What?
I try
Okay.
to I try to talk to parents all the time in the clinic. Most of it goes well, but I even have some parents that get very upset and say some really
Mm-hmm.
mean things.
Ugly. Mm-hmm.
Yeah, yeah. And so some
Okay.
people take this personally. When you challenge or talk about their parenting, right?
Right.
That's a no-go for them. That's none of your business. You can't speak on my
Mhm.
parenting or my discipline. That has nothing to do with you. And so we do try to make that a normal part of our care. We put it in with our anticipatory guidance sheets that lets parents know what's coming for their child developmentally. And we kind of throw in some of those disciplinary strategies like for those things. And so
Okay.
I'll mention
Okay.
that type of stuff, kind of do it sneaky. And then when I'm in the exam room, remember I gave you that example of like the child misbehaving, the parent getting a little agitated, and then
Right.
I kind of redirect them to drawing.
Uh-huh.
And so that modeling is very important. I've had lots of parents that say, "Oh, I'll have to use that next time." And I go, "Yeah."
Mm.
And then I'll say, "I got more where that came from." And whenever you need it, whenever you need it, or I tell them about the
Right.
book or the
Right.
podcast or something. So yeah, we just have to they can't take it all at one time. It's bits and pieces.
Yeah,
Yeah.
not only that, I would think too. I'm sorry, Maria, were you still talking to my
Okay,
thought?
just one other quick
Oh,
question. You
please.
talked about the fact that you have a book of resources. I have never been to a pediatrician that had a book of resources that talk about this is your child with this you're having this issue. Let me send you to here. Let me send you to here. So that was like amazing. You're talking about, oh, I got this big thick book of resources, and I'm like, okay, is that is that something that you put together? Is that something that's available just because it's in your area, or where would you even get something like that to let other pediatricians to know this is absolutely critical? If you're gonna, because you're not really treating the child, you're treating the family.
Right, right,
Right.
absolutely. All pediatricians, all doctors should have like they have their referral clerks and people, and they have their resources where they can
Okay.
refer patients out to. Because of our
Okay.
unique patient population, we have intentionally built up resources. We're always looking, we're always
Okay.
searching. As you know, things
Okay.
change and close
Got you.
down. And so our office manager is amazing. Elizabeth and Dr. Kaplan, we're constantly
Okay.
emailing each other and sharing something about something. And then being in the CRC network has helped with resources as well. So we just kind of added on over
Okay.
time. And I think a big resource for me when I got here early on was 211. If I can't find
Okay.
it in the book or something doesn't fit, I just call the number
Mm-hmm.
and I'll tell them what's
Okay.
going on. And if the parent is willing, they'll follow up with the parent or they'll follow up with me to see if it all worked out. But they will have some resources as well.
Okay.
Okay.
Yeah.
Okay.
Great.
Thank
Thank
you.
you, Ms. Long. Any more questions?
Now I
I
see
know.
one quick
I'm
thing
going.
before I go to
Please go.
Lauren. Angela says her question was similar to Maria, and she's concerned. She said she will definitely share this with her husband for the grandparents because they may be leaving their daughter in their care. And so she just wants to make sure that everybody is on that same, as best as possible, disciplinary plan. And that is key. That is absolutely key. And thank you, Lauren. She said she got the book and she's going to send it to her son. And Darla asked, do you have any scheduled presentations coming up for parents to hear more about your book? You know what? I don't right now, but things do come to me like at spur of the moment, all the time. And I really appreciate Rachel and PJI for thinking of this concept for me to do with the book. I do some things with the AAP around the book. And so anything I'm doing, I'm going to share on my social media. I'm on all platforms at Dr. Candice MD. And I do live sometime around parenting topics and some blogging on my website, drcandicemd.com. And I am thinking about turning this into a type of curriculum and doing some parenting classes in our practice. And if it grows, I can do it elsewhere. And I do have some, I think the Central Florida Urban League, I will be taking my book over to them and talking to their behavioral technicians. So there's a lot to come, and I will share. And if you're interested, we can talk about something for sure. So
Great. Well, thank you. I know we're almost out of time. Do we have any more questions before I?
Yeah, we'll have to take Lauren, and that'll be the last one.
Okay, Lauren, let's go with Lauren.
Okay, I noticed what Angela had put in the chat as well in reference to grandparents. Well, my 3 kids decided to sit down and have what I call a come to Jesus meeting with grandma, because grandma used to discipline them different than the way they plan to discipline their kids. So they were like, okay, mom, we're 3 successful folks. So, I mean, obviously what you did, it worked, but we're not raising our kids this way.
Interesting.
And I was like, the good part is that I was already involved in ACES at the time when they brought this come to Jesus to me. So I was like, you know what? I want to follow the way you guys raise your kids. And I will tell you, they are doing exactly what you're saying. And they have these discussions with these little 3-year-olds, like, let's talk about the choice that we want to make. Let's make good choices. Now, you have a choice to do this and a choice to do that. Now, which choice do you think is the best? And I'm sitting there like, back in my day, it's like, go do what I told you to do. You
One choice.
choice. You're 3
One
years
choice.
old, but what it's doing, it's helping them to learn how to make decisions.
Right.
And these little kids, they're like, I feel like I'm talking to college students when I'm talking to them. Like, Grandma, that's not the way that we should do it. And I'm like, okay, this works. I'm gonna play along with the game. So Angela, if you bring it to grandma and grandpa, whomever, in this way, and talk about ACEs, I think it'll be welcoming.
That's great. That's a good way to end.
At least I think it need to be quoted in Dr. Jones's follow-up book, because this is great testimony to that. I want to thank everybody. Dr. Jones, thank you very, very much. It's a difficult subject, and we go back and I always say put a face on it. You put a face on the patient that you see and some of their needs, some of what they're going through with raising their children. It's very difficult. We don't want to over romanticize it. It's hard work, and it is. So, but you made it very understandable today. I'm very encouraged by your book and your podcast and all that you do in the community. So I look forward to purchasing that book for my first son. And when the second one gets married, I'll buy it for him too. And the third one, I'll buy the one for them too.
Thank you so much, Dick, for being
Thank you.
here. Thank you for making a great conversation. And thank all of you guys for being here. I really appreciate it.
Thank you very much. Y'all have a great
Have a
weekend.
great evening. All right.
Bye-bye.
Bye-bye.